And we will give you a recap of the symptoms to COVID-19. And as you can see right here, so the most common symptoms of COVID-19 is, of course, a fever, dry cough, and tiredness. And the less common symptoms would be aches and pains, sore throats, diarrhea, conjunctivitis, headache, and loss of taste or smell, and in some cases a rash on their skins or discoloration of their fingers or their toes. And in the serious symptoms would be those with difficulty breathing or shortness of breath, as well as chest pain or pressure, as well as loss of speech or movement. So these are the symptoms of COVID-19 that you might check in case that you were wondering whether you've been infected with COVID-19 or not. But although these are the symptoms we're telling you right now, but it's best to get tested or ask a doctor for advice. And these are the symptoms that you can see right here. And if you feel that you've got COVID-19, seek immediate medical attention if you have serious symptoms, and always call before visiting your doctor or a health facility. And on average, it takes around 5 to 6 days from when someone is infected with the virus for symptoms to show. However, some of the symptoms can take up to 14 days to show as well. So another big question is, what about those who are pregnant or breastfeeding?
Yes, because in Nonthaburi yesterday, we learned the news that they reported there is one case that is a pregnant woman. So there is a question of whether she will be able to give birth safely. Would it be transferred to her child? And once she gave birth, if she's still sick, can she breastfeed? So WHO actually has these answers for you. For the question that can COVID-19 be passed from a woman to her unborn or newborn baby, the WHO said that they still do not know if a pregnant woman with COVID-19 can pass the virus to her fetus or baby during pregnancy or delivery. But to date, the active virus has not been found in samples of fluid around the baby in the womb or breast milk. And for the question of whether COVID-19 can be passed through breastfeeding, the answer is transmission of active COVID-19 through breast milk and breastfeeding has not been detected to date. There is no reason to avoid or stop breastfeeding. And another question is whether women with confirmed or suspected COVID-19 breastfeed. The answer is yes. Women with confirmed or suspected COVID-19 can breastfeed if they wish to do so, but they should wash their hands frequently with soap and water or use alcohol-based hand rub, and especially before touching the baby. They should wear a medical mask during any contact with a baby, including while feeding. They sneeze or cough, they have to sneeze or cough into a tissue, then dispose of it immediately and wash hands again. Routinely clean and disinfect surfaces and that mothers have touched. It is very important to replace medical masks as soon as they become damp and dispose of them immediately. Masks should not be reused or touched in the front. So in short answer, you can still breastfeed, but you just have to be very, very careful. Think of it as when if you have flu and you have to breastfeed your child, you just have to wear a mask and then keep your hands clean and keep disinfected surfaces and something like that, pretty much along the same line.